from Bachelor of Science in Business Administration, major in Financial Management. In this video, I will going to discuss the second type of my home-based advocacy COVID-19 and health protocols. COVID-19 virus spreads mainly between people in closer contact with each other. It spreads more easily in crowded settings, close speed with poor ventilation, or through prolonged contact with an infected person. This is because as a person infected with the COVID-19 virus breathes, talks, coughs, or sneezes, liquid particles of various size are expelled into the air. Larger particles are called droplets. Smaller particles are called aerosols. You can contract the virus if infected particles come into contact with your eyes, nose, or mouth. Whether you are inside or outside, always maintain a physical distance of at least 1 meter from others. When you are an enclosed or poorly ventilated space, the virus can spread more easily. In these conditions, aerosols can maintain suspended in the air or travel farther than 1 meter. When you are inside, make sure to stay at least 1 meter from others. Wear a face mask, open a window to improve ventilation, and limit your time spent in these settings. To protect yourself and others, always follow these 6 precautions. SARS-CoV-2, the virus that causes COVID-19, is continually mutating as we know. Mutations in their genetics can modify how a virus looks or affects that its host. A virus is called a variant of the original virus when it has one or more additional mutations. The Center for Disease Control and Prevention (CDC) has identified a variety of viral variants that cause COVID-19 as variants of concern. We've seen a number of notable variants since the outbreak began, including Alpha, Beta, and Omicron. The earliest of the most publicized variants was Alpha. In September 2020, Alpha initially appeared in the United Kingdom and infections spiked in December of the year. It was thought that the Alpha variant lineage was 30–50% more contagious than the initial SARS-CoV-2 strain. According to studies, the Alpha lineage was more likely than the original virus to send sick patients to the hospital and will also dead less. And Alpha instances, Pfizer, Moderna, and Johnson & Johnson all claim that their vaccines were successful and averting serious and hospitalization. At the end of 2020, the Beta variant was discovered in South Africa and quietly spread to other countries. Experts were concerned about its many alterations and the possibility of evading antibodies. According to the CDC, Beta was 50% more contagious than the initial coronavirus strain. There was some indication that Beta was more likely than other variants to result in hospitalization. After clinical testing, it revealed that the AstraZeneca vaccine did not give sufficient protection against mild and severe illness caused by the Beta strain. South Africa discontinued selling in early 2021. Pfizer, Moderna, and Johnson & Johnson all reported lower Beta protection. In October of 2020, the Delta variant was first discovered in India. Delta was thought to be more contagious than preceding variants by more than a factor of 2. And it's possible that this variant will result in more severe symptoms than the other. According to studies, it is more likely to send infected patients to the hospital than the original virus. It was thought to be 80–90% more transmissible than the Alpha version. The unvaccinated were the most vulnerable areas with low vaccination rate has the most causes and severely outcomes. The Omicron variant was discovered for the first time on November 2021 in South Africa. It is easiest to spread than other variants. Omicron replaced Delta as the predominant variant. Omicron infections are thought to spread quietly due to a combination of heightened transmissibility and the capacity to circumventing immunity provided by previous infection or vaccination. And general data suggests that Omicron is less severe. A spike in instance, on the other hand, could result in major increases, hospitalization, and death. Data also shows that those who have been vaccinated and have had a booster dose who have been previously infected are more likely to be protected against Omicron.